Good morning everyone. This is my first video in YouTube and we are gonna study about the peptic ulcer. The question is classify drug used in peptic ulcer, mechanism of action, pharmacological action, therapeutic use, ADR of proton pump inhibitor. Let's classify it. Drugs for peptic ulcer. First comes the gastric acid secretion inhibitor, then neutralizer and ulcer protectives and anti-H. pylori drugs. Under gastric acid secretion inhibitor, there comes the H2 antagonist or H2 antihistamines and proton pump inhibitor. As proton pump inhibitors start with pro, its drug also has pra in it. You can remember by this way. The examples are omeprazole, esomeprazole, rabeprazole. Then the example for H2 antihistamines are ranitidine, roxetidine and cimetidine. You should remember tidine in H2 antihistamines. Then comes the gastric acid neutralizer. Systemic, sodium bicarbonate, sodium citrate. Sodium, it is systemic, so S, then sodium bicarbonate and sodium citrate. Then comes the non-systemic gastric acid neutralizer. It is calcium carbonate. Ulcer protectives, CBS,
bismuth substrate.
And this also comes in anti-H. pylori drug. To remember H. pylori drug, anti-H. pylori drug, you can remember college ATM. C means CBS, A is amoxicillin and T is for tetracycline and M is for metronidazole. Then comes the mechanism of action. It is given 1 hour before the food. The mechanism of action is it binds to hydrogen potassium ATPase pump and irreversibly inhibit the hydrogen potassium ATPase pump present in parietal cells of gastric mucosa and suppresses gastric acid secretion. And its uses are gastroesophageal reflux disease, that is GERD, and peptic ulcer diseases and Zollinger-Ellison syndrome. It is a tumor esophagitis. Treat H. pylori drug with antibiotics. As we have learnt in the classification, we have anti-pylori drug that are college ATM. The side effects are headache, rashes, and increase in risk of fracture in elderly people. Then on long-term uses, causes atrophic gastritis, deficiency of calcium, ferrous, vitamin B12 and magnesium deficiency, increase in gastric acids, carcinoid tumor, that is Zollinger-Ellison syndrome. And comes the pharmacological action. It has a dose-dependent suppression of gastric acid and secretion without blocking any transmission receptor. Pharmacological action. It is a dose-dependent suppression of gastric acid secretion without blocking any transmitter receptor. And on powerful inhibition of gastric acid can totally abolish HCl secretion without much effect on the secretion of pepsin and intrinsic factor, juice volume or gastric motility. It is a dose-dependent gastric acid inhibitor and blocks the mechanism of action is hydrogen potassium ATPase pump inhibitor in the parietal cell. This is the shortest way to read the peptic ulcer. You can revise it with this or last minute preparation.